Hi, my name is Victoria. I'm a child psychiatrist, parent coach, and I'm also a mum. And this video is very much thinking with you about what kind of professional might be helpful depending on the kind of challenges that you have, really. So I'm just going to talk a little bit about the different professionals here. So psychiatrists, therapists, and coaching. Obviously not spies because that was just put in there for a bit of fun. And if you do want a little bit more detail on these, if you have a teen in the teen mental health course, there is some very more in-depth information really about different professionals, different types of psychologists and that kind of thing. So you can have a look at what is best for your child. So if you do really want some more in-depth information, definitely have a look there. And really, this is the kind of thing that people do ask me both in the Facebook community group and also sometimes when people get in touch with me wondering whether they want to do some individual coaching. They sort of want to know, well, should I go for coaching or actually should I be looking to get a therapist? Maybe for myself, maybe for my child, or actually, do I need to be getting a medic involved, like a psychiatrist? And of course, I've personally had coaching and I've personally had therapy as well, so I sort of have also my own personal experience of doing those things as well as professional experience working with a lot of different therapists, coaches, and obviously psychiatrists as well. So I'll start off with thinking about psychiatrists. If your child is going through an assessment process in CAMS, they may or may not see a psychiatrist. You don't always get to see one. In fact, most children are assessed without any kind of medic involved, and some parents wonder whether they should get a private opinion from a psychiatrist, for example. And I think one of the things that it's really helpful for sort of having a psychiatrist opinion is that they do look at a whole variety of different things and they sort of think about diagnoses. So if you are thinking a diagnosis might be helpful, maybe it will help get you the right services, maybe it will help get the right therapy and medication. Of course, finding a psychiatrist privately if you can't go and get one on CAMS because they just don't, get psychiatric opinion there, it may well be helpful. And also they tend to look at a variety of different things. They'll rule out any kind of physical health things that might cause the difficulties your child is experiencing. And a good psychiatrist, child adolescent psychiatrist, will just look at everything and kind of come up with a bit of a formulation as well as a diagnosis about what's going on. And it will help you understand what is going on for your child, but it will be through a medical lens and it will be focused on your child getting some kind of treatment. So if what you're wanting is to think about the kind of treatment they're going to need, then absolutely getting a psychiatrist is really helpful and getting that psychiatric opinion. In terms of therapists, getting a therapist for your child, if they have got some kind of diagnosis, and there's a therapy that's available for that has a good evidence base, absolutely, this is a kind of treatment and it's important to get a therapist for them. Therapist for yourself, I think, is slightly different. And I always think, when should you get a therapist really? And that's when you still have some difficulties that you want to iron out. So if you have your own mental health difficulties, you might have a diagnosis and there is a treatment for that, that's a therapy. In exactly the same way, really helpful for you to do that, to go through that therapy so that your mental state is the best it can be. Because if you're supporting a child that's having difficulties, you really need your own mental health to be as okay as it can be. In terms of family therapy as well, so that obviously includes everyone, your child and other family members. If there are some very complex family dynamics, might be absolutely the right thing. Family therapy has good evidence base for a variety of different illnesses, especially eating disorders. So it is something that's really important, but it will usually not be specific to you. It will be for the whole family. So I think of therapy as something that you might use if you've still got things that need to be sorted out for you to be okay. And those could also be previous traumatic experiences, very difficult relationships. If you've come out, of an abusive relationship, for example, then those things might need to be reflected on and processed for you to be in the best place. So when might you come to coaching? Well, I think coaching is almost like the next step. It's when you're feeling okay in yourself and you're feeling steady and you're kind of ready to do things differently. You're ready to do things differently in terms of your parenting. You want to support your child in the best way. You've been trying, it hasn't been working. You're feeling all right in yourself. You don't feel things from the past are really encroaching on your mental state. You think your mental health's okay. and you need some guidance to try things out, and you need someone to help think through different options, and you just want to do something practical, and it's about the future. It's about going forward and changing things so that the future is better for your whole family and of course for your child. And one of the other different things about coaching is often doesn't, involve reflecting lots and lots on the past. It might involve some of that, but a lot of it is really about focusing on the challenge in hand and finding practical solutions to that, whether they're sort of mindset shifts or you changing some of the things that you do, but it's something very much focused on the challenge that you're experiencing. And often coaches are also kind of your cheerleaders. And of course, if you ever had therapy, you may well have a really positive relationship with a therapist and find it a very safe kind of space to be when you go and see them. But often there is a kind of boundary between therapist and you, and it has to be there to allow for the therapy to occur. And coaches are often not bound by the same rules and can just be a lot more positive and supportive of you in a more flexible way. And I often found that with coaching, you don't necessarily have to have as many sessions as you do with therapy. My own personal experience, I had a whole year's worth of therapy where I had therapy most weeks, and I needed that amount of time to look at the things that I needed to look at. Whereas when it came to coaching, I only ended up having about 10 sessions, because actually that is what I needed, because in between times you've got so much to work on, you've got so much to try. It's a much more practical thing where you're experimenting yourself and someone is just alongside you to kind of bounce ideas off and to offer you some guidance, but actually you're doing a lot of the work yourself, and you're kind of experimenting with things. So it's much more driven by you. The coaching is very much driven by what is important to you right now. And if you're listening to this and thinking, okay, well, actually, I'm probably in the right place for coaching, and that's exactly what I would like, please do get in touch. You can have a 20-minute chat. You can sort of think about whether coaching is the right thing right now. And if you think it is, then we can book a session, because I really do think that supporting parents to support their kids is one of the most important things to do, really. And if you're in an okay place and you just need a bit of guidance and a bit of some ideas of what you can do differently, then coaching might well be exactly the right thing to do. So please do get in touch.